In several parts of the world, hidden danger does not always arrive with fanfare or caution. It hides in mosquito bites, untreated fevers, and in silent infections. Yet in those same corners, some individuals persevere differently. They bring more than medicine. They bring community, equity, a sense of belonging, and hope for the underprivileged. They are part of a global movement, the Global Fund to Fight AIDS, Tuberculosis, and Malaria. In 2002, a global health emergency demanded a global solution. Human immunodeficiency virus, tuberculosis, and malaria were threatening the lives and livelihoods of millions, and the world recognized that fragmented efforts were not enough. From the halls of the United Nations to grassroots campaigns in Africa, the message was clear: fight these diseases together or lose more lives. Born from this urgency, the Global Fund was created, a unique partnership that pooled resources from across governments, civil society, and the private sector. Among its first champions was Bill Gates, whose early support helped turn vision into action. From that moment onwards, the Global Fund became more than an organization. It became a lifeline. The Global Fund does not dictate solutions, it provides hope. It does not arrive with blueprints, it helps build them, hand in hand with those who live the reality of a disease every day. Through country coordinating mechanisms, each country defines its own priorities, bringing together HIV and tuberculosis patients, caregivers, civil society leaders, and government officials sitting at the same table. This is more than collaboration. It is the architecture of shared responsibility, grounded in transparency, committed to equity, and guided by the principle that health belongs to everyone. Behind every data point is a story of resilience. Behind every percentage is a life reclaimed. Since 2002, the Global Fund has enabled countries to save over 70 million lives. 25 million individuals are now living healthier, longer lives with access to antiretroviral therapy. 7.1 million have overcome tuberculosis, a disease once thought incurable. 227 million mosquito nets have turned houses into safe heavens. The Global Fund strengthens the foundations of care by training health workers, building lab systems, and restoring trust in public health. When COVID-19 disrupted the world, the fund did not pause. It adopted channeling emergency support, preserving essential services, and helping fragile health systems withstand the storm and emerge resilient. The Global Fund is not just financing programs. It is nurturing a new future, one where communities lead, where data drives decisions, and where progress is measured not just in numbers, but in dignity restored. Operating in over 155 countries, it is often the primary lifeline for national responses to HIV, tuberculosis, and malaria. As we race toward the Sustainable Development Goals, the Global Fund is a catalyst, bridging global ambition with location action. Its model is bold but simple: trust partnerships, follow evidence, stay human. Every mosquito net draped, every vaccine administered, every life is given a second chance. These are not just outcomes, are declarations of what humanity can achieve when it stands together. At 72 Dragons, we celebrate the Global Fund's enduring mission to make healthcare universal, to make survival equitable, and to make health a right, not a privilege. Thank you to those who turn funding into healing and data into action. You are changing the future of global health. Visit 72 Dragons Health to learn more about the innovation and courage shaping our world. Because in a world divided by borders, care must remain boundless.